Okay. We have so many questions. So I'll just begin. Someone asks, are there biomarkers or cell signaling pathways that link ADHD with inflammatory conditions, chronic pain, anxiety, and joint hypermobility?
Yes, there is. I was sort of explaining, but without slides because it isn't data that we've properly published yet. That we have found a gene expression link between hypermobility, chronic pain and fatigue, ADHD, and hypermobility. And we're presenting this at a big rheumatology conference in June. So there is research, but it's very limited and we need to get it out there. I personally think that this sort of finding should break the internet, but it won't. But hopefully we'll have it published in an open access journal soon, and we will be able to propel and encourage other researchers to continue to look into this link.
How do these changes, how do these changes or how do these conditions rather change over time and throughout the lifespan, or do they?
Oh, such an interesting question. So one of the more hardest audiences that I have in general is pediatricians, because a lot of children seem to be hypermobile. I work with adults, and by the time you're an adult, it's kind of quite clear whether you're still hypermobile or not. Hypermobility and neurodivergence, they're both highly heritable. They run in families. They may well even kind of be inherited together, or the processes affecting the development of connective tissue are also affecting the development of the nervous system. What we know is that hormones interact with connective tissue. So people who have been pregnant, for example, may have experienced this condition called pubic symphysis dysfunction or pelvic girdle dysfunction. So we know that certain hormones make tissues laxer, and that is definitely the case with hypermobility. We know that people say that in different phases of the menstrual cycle, their hypermobility symptoms and their ADHD and sometimes even autistic features are worse just before their period. We know that as you get older, sometimes joints stiffen, and so you may not look hypermobile on the outside, but you're still experiencing lots of hypermobility related features. And if anyone's interested in finding out more about the influence of hormones and hypermobility in these conditions, in my link tree, you'll find a link to a podcast called the ADHD Well Women's Podcast, where I talk about these things in a little bit more depth.
Okay. People are asking about diet and exercise. Are there specific diets or foods that people should eat or stay away from with these conditions?
Well, I think there's so much more that we need to research and find out. And it may be that the intersection of hypermobility and neurodivergence, that there is effects on the kind of metabolic system and the way that we process certain foods. But I think the real thing is that exercise has been shown to be quite helpful in ADHD. And now hypermobility, exercise can be problematic. I'm sitting here having subluxed an ankle tendon while sitting in my chair, but it is important to remain active, but to have appropriate expectations. So if you're a hypermobile person, don't immediately think, oh, I'm going to sign up for a half marathon. You've got to build up physical exercise gradually, and if you're struggling, to build it down gradually, sort of energy accounting, physical accounting, but that yes, certain things like Pilates, core strengthening exercises can be really helpful for hypermobile people. So if your core is stronger, that means you're less likely to have widespread pain problems like neck problems, back problems, shoulder problems. And so I think that it is really important to keep active, but in the right way and not to overdo it, and to be mindful of injury, but to really focus on improving your core stability.
A few people had asked about dry needling, if dry needling could help,
Hmm.
that you would receive from a chiropractor.
I'm afraid I'm not an expert in
Okay.
that sort of situation.
Okay. We had a few questions around hypermobility and healing. Some people said they were slower to heal from injuries or surgery. And is there a connection between slower healing and hypermobility?
Yes, absolutely. So we could talk about this sort of thing for a long time. So hypermobility is often associated with poor wound healing. Um, and the tissues are sort of stretchier and they don't necessarily stick together so well. Hypermobile people often have these very thin, papery scars, which is actually part of the diagnostic criteria. One of the things that can happen is hypermobile people, because their joints naturally have an extended range of motion, they could say be being examined, and they could have a significant problem in terms of their mobility, but it would appear that they still had a good range of movement. Or they could have surgery and it turns out that they sort of compensating with other joints that have a good range of movement, and that actually healing and recovering. Well, I know this from personal experience, having had a hip replacement at 36, that you can kind of cheat in some ways in the short term, but that doesn't necessarily bode well for the long term. So yes, both in terms of wound healing and actual mechanical functioning, healing can be affected.
Okay. Does linking hypermobility and neurodivergence and autonomic dysfunction change any treatment recommendations for ADHD?
Well, this is an interesting one. So the dysautonomia, the big one is the postural tachycardia syndrome. Now, lots and lots of our patients seem to experience problems with this. Now, there are several reasons why people might have postural tachycardia syndrome, but one of the most common reasons is, as I described, blood being in the wrong part of the body or not enough blood, like a blood volume problem, which you can improve with electrolytes and stuff. ADHD medicine in the United States is often actually used to treat postural tachycardia syndrome, because some stimulants in some people have a vasoconstrictive effect. So they cause the blood vessels to constrict, which means that blood is more likely to get back to the heart, and then you're less likely to have some of the postural tachycardia problems, which for some clinicians sounds counterintuitive, because they think, oh, I'm going to start a patient on stimulants, I'm worried they might develop tachycardia. It might actually paradoxically improve their tachycardia. But every patient is different, and you need to take advice from your medical professional. But what we've also noticed is that some of the techniques for helping with postural tachycardia syndrome, they include things like compression stockings and compression garments. They can help people feel so they have a better sense of who they are, and that this can improve their emotion regulation. It sounds really strange, but we've had patients who've been self-harming, then they've started wearing compression garments, and seems like they're more in touch with their body. They have a better sense of the limits of their body and what their body is doing in space because of the feedback from the compression garments. So I think that there is a lot of ways in which abnormalities of the autonomic nervous system, neurodivergence, and hypermobility interact. I also remember when I was first reading about the autonomic problems that you get in hypermobility, reading about what was then talked about as flapping in autism, which we might think of as stimming and self soothing behaviors. And it was actually hypothesized that some stimming behaviors may well be an attempt to regulate a dysregulated autonomic nervous system.
I'm still blown away by the compression stockings helping self-harm behavior.
This is
What-
clinical finding. We haven't done a research study, but it is really interesting. So I have ADHD, I'm ADHD. I don't really feel like I exist properly unless I'm touching one other part of my body. I don't know if other people recognize that, but I'm sitting here cross-legged. I'm often touching my face, fiddling with touching my fingers. There's something about the feedback of having one part of my body on my body that helps me feel grounded. And I'm not going to purport to generalize this to the whole population, but I think for hypermobile neurodivergent people, having a better sense of feedback about how the body is can make a huge difference. We haven't touched on it at all in this webinar, but there is a relationship between hypermobility, neurodivergence, and this thing called interoception, which is the inner sense of what is happening in the body. And we could talk about that for hours. And if you go to my link tree, there are more information about it. And we actually designed a new non-drug treatment for anxiety in hypermobility that's been shown to work in anxiety in autistic people, that is about improving this sense of what's happening inside your body. But if the compression stockings help return blood to the heart, and you're less likely to feel heartbeaty, brain fogged, dizzy, you can imagine that you might feel better. So patients come to me, and I've seen this on social media as well, saying, they really resonate with the statement, oh, I thought I was anxious, but actually it was too hot and my clothes were too tight. And we really underestimate the power of the sensory environment in terms of our emotional feelings. And we often attribute discomfort or discombobulation to anxiety, when in fact, it's not because we're particularly worried or anxious in the cognitive thinking of anxiety sense. It's because there's something off in terms of our sensory system.
Wow, that's fascinating. We had a lot of issues around questions around sleep issues, sleep disorders, sleep disturbances, and hypermobility. Is there a link? I know ADHD and sleep disturbances, there's a connection. Is that true with hypermobility too? Mm-hmm.
Yes. Well, as far as I'm aware, there's a research literature linking hypermobility to sleep apnea. And you can imagine if you have a floppy gullet, that you might be more likely to have sleep apnea. And I have certainly seen in our neurodivergent brain body clinic several slim young men who you would not expect to have sleep apnea turn out to have sleep apnea, and that to be a contributing factor to their terrible insomnia and terrible fatigue.
Wow. Do you have recommendations for that?
I think
treatment?
if you well, I'm afraid I'm not a sleep specialist, but if you think you're getting unrefreshing sleep and you are actually going to sleep, some ADHD people really struggle to get to sleep at all. But if you think you are sleeping, but you are maybe gasping or breath holding, in the night, then it would be worth trying to get a proper sleep study to see if you have sleep apnea or something similar. People, ADHD people, insomnia and circadian rhythm problems are really a massive issue. Again, not in the diagnostic criteria, but it's actually very hard to find someone with ADHD who doesn't have some form of sleep problem. Um, and we know that sleep problems make emotion regulation and everything else much more complicated. So, getting into good sleep habits, I mean, that's easier said than done, isn't it? We often in clinic prescribe things like we in the UK it has to be prescribed. It's not available in supermarkets. Melatonin and things like that. But I think there needs to be further research about the intersection between joint hypermobility, neurodivergence, and sleep.
We also have questions asking about hypermobility and migraine headaches. Is there an association? Can you talk a little bit about that?
There is an association between hypermobility and headaches. And you can imagine that migraines are to do with bloods being in the wrong place. And you can sort of see that how the connective tissue, vasculature situation could definitely be related to hypermobility. So we are actively at Brighton Sussex Medical School with Professor Hugo Critchley and colleagues. We are trying to set up some lines of research to look further into the relationship between hypermobility, neurodivergence, and migraine.
Okay. Is there a connection between fibromyalgia and hypermobility? Someone asked.
Oh, yes. So I touched upon it in one of the slides, and I've got some other presentations on my link tree that will talk a little bit more about it. But we know from work that we did that 80% of people with fibromyalgia meet diagnostic criteria for symptomatic hypermobility. I suspect that the vast majority of people with fibromyalgia actually are hypermobile. And hypermobility and fibromyalgia have been associated before the work that we did. And I think we know in fibromyalgia that people often have gut problems, dizziness. I think it's not all of the time, but most of the time I think this could well be related to hypermobility.
Is there a connection between trauma and these conditions? A few people have asked.
Do you mean childhood trauma?
Well, it doesn't specify.
Or do you mean orthopedic trauma?
Oh, I think
okay.
I think childhood trauma is.
Yeah. Yes. So there is some really interesting research that shows that being a patient trying to get a hypermobility diagnosis, trying to be understood as a hypermobile person, induces clinician associated traumatization. So the whole medical process in and of itself is traumatizing. In terms of direct research linking hypermobility to emotional trauma, I don't think there is a huge amount, but there are two really interesting ways in which you can make that connection. So there is a big literature in fibromyalgia about adverse childhood experiences and fibromyalgia. Doesn't mean to say that they are the cause and the effect, but that they are definitely linked. Now, I know with colleagues, Professor Helen Minnis in Glasgow has written a wonderful paper called Double Jeopardy about how if you are neurodivergent, you are more likely to be traumatized. So she started looking at children with very adverse childhood experiences and finding them, a lot more of them than you would expect, have ADHD or are autistic. Now, what I hypothesize is not only if you are neurodivergent, are you more likely to be traumatized, for example, by being bullied or, not fitting into the right world, or by family structures and things. You, as a neurodivergent person, you are living potentially in this hypermobile body with this very finely tuned autonomic nervous system that predisposes you to fight or flight. I think you then process trauma differently. So it's a double jeopardy and a double whammy.
When you say process it differently, like more intensely?
I mean, in terms of the vivid feelings of hypervigilance. And, you know, if you talk to some neurodivergent people, they have a very vivid mental imagery. This is called hyperphantasia. You can imagine how if you combine a body that has got a hair trigger response because of these differences in the autonomic nervous system, you've got a brain that is reliving trauma in technicolor, and you have and you are feeling constantly on edge, and you're predisposed to anxiety. That is a recipe potentially for reliving trauma, experiencing flashbacks, and experiencing hypervigilance, all of which are hallmarks of post-traumatic stress.
Wow. Okay. Someone asks if you can test genetically for hypermobility.
This is an interesting one. So it's like autism and ADHD. There are certain rare types, so something like Fragile X, which people often have autism. You know, there is a genetic, there is a single gene or a genetic reason for it. You have the same thing in hypermobility. There are 13 or 14, it's under debate, types of Ehlers-Danlos syndrome, and all of them but one have clear genetic causes. So mutations in things like collagens and tenasins, these extracellular matrix proteins. The one that doesn't have a single genetic cause is hypermobile Ehlers-Danlos syndrome, and it is hypermobile Ehlers-Danlos syndrome that is the most common. Now, my mother and I were featured in a public engagement event in London recently talking about ADHD, and it was introduced by Professor Philip Shaw, and he talked about a day in which he saw 3 different women at different stages of their life. One, you know, I don't know, 7, another 30, another 50, and he's like, how can this all be? And the answer was they were all in the same family. And ADHD and hypermobility are really as heritable as height, which is what he was saying about ADHD. If you have a family member who is hypermobile, it would seem highly likely that you will be hypermobile. But there are some rare occasions in which you may not have hypermobile family members and you are hypermobile.
Okay. We had a question. We had a few questions around chronic pain issues. A woman writes, my son is hypermobile. He has ADHD. He's been diagnosed with chronic pain disorder. It has severely impacted his quality of life. Do you have recommendations to help him navigate his days? He's 18 and he just finished his first year of college and he's in constant pain.
I think it's one of the biggest things that we see in the neurodivergent brain body clinic is this overlap between ADHD and pain. I think people with ADHD, they have a couple of things going on. They often want to run before they can crawl. They find it hard to say no to interesting things, and they can be all or nothing. Which means that if you are that type of person, trying to do pain rehab is really, really hard. And trying to get some core stability work, so like I was talking about with Pilates, and also some strengthening and heart raising exercise is really important. But what we know for neurodivergent people, especially neurodivergent people who've just gone to college and are having completely, their schedule and everything is completely different, is how to incorporate that sort of self-care into a routine is so, so hard. Because hypermobile people, they don't do well with opioids. We don't want people taking opioids for pain. We want We want people to like you know, for their bodies to support them better, and also for their brains and bodies to work well. One of the big problems for ADHD people, and this is a big problem for me, having, you know, recently subluxed disc, subluxed an ankle and prolapsed disc, is you can hyper focus and be sitting in the same position for ages, and that position is often not an ergonomic position. So, really thinking, how is it that I study? Am I hunched over a laptop? Should I be using a desktop? Is my chair the right height? Is everything adjustable? These sort of things should really be thought about. Have I got arch support in my shoes? Do I have flat feet? We need to think about all of those things before thinking, is there a pill that's going to make this better?